Reason number 8, third-party insurance payments. The 8th reason for why healthcare is so expensive is that somebody else pays the bill. Some people worry that if they don't have health insurance, they won't be able to get the lowest price for medical services. However, health insurance itself has raised the cost of medical care, making it more difficult to go without health insurance. Jason Furman, the current White House Deputy Economic Director under President Obama, wrote in 2007, 4 decades of empirical research have shown that in insulating people through third-party insurance coverage from the full cost of health care has been responsible for anywhere from 10 to 50% of the large increase in health expenditures. He notes that while households may be shielded from out-of-pocket costs, they cannot be shielded from paying the full cost through premiums, foregone wages, or higher taxes. Amy Finkelstein from MIT estimates that the impact of Medicare on hospital spending is over 6 times larger than what the evidence from individual level changes in health insurance could have predicted. And she says that the overall spread of health insurance between 1950 and 1990 may be able to explain about half of the increase in real per capita health spending over this time period. In other words, insurance itself has made healthcare more expensive. Have you considered how inexpensive medical services could be if you actually paid the bill in cash, check, or charge? One doctor recently told me that his staff of 7 physicians have 10 backroom clerks simply to do the administrative coding and billing. Have you ever wondered why there are more than 10 CT and MRI scanners up and down France Avenue in Minneapolis? And why the price is universally high? It's because there is no competition. Imagine if your insurance didn't pay for CT and MRI scans. Imagine if no insurance did. Now, how would those who own CT and MRI scanners get you into their door? They'd advertise the price and they'd bring it down to the level that you found acceptable. One doctor told me that if that happened, the price of a CT scan could drop to as low as $100 per scan. There are doctors and clinics and even a surgical center that have begun to refuse all insurance payments and Medicare. They are cash only. The focus on patients is back, the cost of care is significantly reduced, and the staff is not deluged in paperwork. Patients must begin now to start paying directly for the care they receive, and it must be their responsibility to secure repayment by their insurance company for major medical bills. President Obama's national health care plan will not constrain costs. It will not even begin to deal with the underlying reasons for high costs. It will only restrict access to care while building a new costly regime of government regulators and government controllers. As costs skyrocket and citizens are forced to prepay for care that they may not even be allowed to receive, patients will be left with few options when the doctor or the government says no. The only humane and ethical healthcare reform is a reform that tackles these 8 reasons for expensive healthcare today. Reform that does not is not true reform. It's a deceptive ruse on the American people that will socialize the best private medical system in the world, cost them more than they can afford to pay, and deny and limit access to the medical care they need. Thank you for listening, and for more information, contact us at www.healthcarefreedom.us. Thank you.